Good evening, all of you. Am I audible? If I'm audible, can I get a thumbs up, please? Yes. Um, no, Amit Soni, this is not a part of 1 hour daily biochemistry. The 1 hour daily biochemistry will be conducted on the app, on the platform as special classes. This is a continuation of entire biochemistry in 4 hours. I've already finished 3 hours. This is the last 1 hour of biochemistry. So today I will be telling about amino acid metabolism. So the plan for today's session is to tell you all essential facts. So I will be telling you all essential facts related to amino acid metabolism. Okay. So before we start the session, let me tell you a few facts about Unacademy plans. Special class features include interactive live session. You'll be able to participate in polls. And using the raise a hand option, you'll be able to interact with the educator one-on-one and you can get your doubts clarified real time. And apart from this, there are multiple free tests that are happening on the platform. So all these free tests can be accessed by anybody who has downloaded the app. So I recommend that all of you attend as many free tests as possible because this will help you understand where you stand. This will help you in recalibrating the path which you have taken so far. And Plus subscription gives you an access to both live and recorded sessions. It also gives you an access to a question bank with 25,000 plus clinical case-based MCQs. And all these questions are being framed based on the latest pattern. Iconic subscription, as you all know, gives you an access to not only an Unacademy platform, it also gives you an access to PrepLadder platform. And whenever you have any of these subscription plans, then that gives you an access to all batches which are happening on an Unacademy platform. And the upcoming batch would be on May 21st. On May 21st, we are starting NEET PG 2022 All Educators Revision Batch. And as the name indicates, this batch will be handled by all educators of Unacademy. And totally there are 130 hours of revision. It will include 8 grant tests and 19 subject-wise tests. So if you take up this batch, you will be able to attempt your NEET PG 2022 with confidence. And if you're an FMG aspirant, then there is Focus FMG 2022 batch, which will start on March 16th, and the duration would be 2 months. And these are our toppers in the latest FMG December 2021. And this is the current NEET PG subscription plan. For 3 months, the minimum that you can opt for is 3-month subscription if it's a plus subscription and 6 months if it's iconic subscription. And you can use any of the educators code to get 10% off. And if you want, you can use my code. My code is C Shanmugapriya or Biochem Live. You can use any of these codes to get 10% off. So that's all about Unacademy plans. Let's start discussing these MCQs one by one. So amino acid metabolism is a topic that I've chosen for today because there are many questions which are asked in amino acid metabolism as far as NEET PG and FMG entrance exam is concerned. And all these questions, most of these questions are factual. So you will have to know all these facts by heart. Okay. So one such fact is the first question. The first question is based on one such fact. The amino acid which does not undergo transamination or deamination is. Can any one of you try answering this? The amino acid which does not undergo transamination or deamination is. Anyone? The answer is threonine. So the first fact that you have to know about amino acids is all amino acids during catabolism, or at least most of these amino acids during catabolism, give off their amino group first, and then their carbon skeleton undergoes catabolism. And when they try to give off their amino groups, very good Pancake, good, very good Suganti Kannan, excellent. And when they give off their amino group, they give off their amino group either through transamination reaction or through deamination reaction. This is a rule for all amino acids. Exception are 4 amino acids. There are 4 amino acids in your metabolic pathway which undergo catabolism along with their amino group. And those 4 amino acids are lysine. Number 1 is lysine. Very good. Lysine, threonine, proline, and hydroxyproline. So tell me, what are the 4 amino acids which do not undergo transamination or deamination? Lysine, threonine, proline, and hydroxyproline. Okay. So what is the answer here? The answer here is threonine. Okay. The next question is, this is an INI-CET November 2021 question. How many of you remember this question? In advanced liver disease, the true statements are. It's a multiple answer question. Choice A, oxidative decarboxylation of alpha ketoglutarate. Choice B, hyperammonemia. Choice C, low ATP production. Choice D is conversion of alpha ketoglutarate to glutamate and glutamine. So what do you think is the right answer here? Can anybody just try your luck? You don't have to be right. Just tell me, what do you think is the right answer? Yes? Anybody? So to be able to answer this question, what you need to know is, you will have to know that urea cycle happens in liver, right? So yeah, many of you are answering it as A and C. Uh, Jyoti Balan thinks it's A. JG thinks it is D. B and C are true. B is true. Okay. So let me tell you, most of you are right. Yeah. So can we discuss about this? So to be able to answer this question, you need to know that urea cycle happens in liver, or in other words, only in liver, ammonia gets converted to urea. So what do you expect to happen in advanced liver disease? Whenever there is advanced liver disease, ammonia cannot be converted to urea. So what will you observe? Definitely in advanced liver disease, there is going to be hyperammonemia. And to be able to comment on other 3 choices, you will have to know the mechanism of ammonia toxicity. We keep saying ammonia is toxic to brain, but you will have to know, why is ammonia toxic to brain? It is because its pKa is very high. Yeah, whenever you're asked what is the mechanism behind the toxicity of ammonia, your answer should be pKa of ammonia is very high. So it senses a surrounding pH of 7.4 as acidic. Yeah, when its pK is high, what will happen when ammonia gets generated within the cell? It senses the surrounding pH as acidic, and to neutralize acidic pH, it gets H plus from the surrounding. So tell me, what will happen when it accepts H plus from the surrounding? Ammonia gets converted to ammonium ions. And these ammonium ions are osmotically active. Yeah, they get trapped within the cell, right? Until it is ammonia, it can come out of the cell, it can get into a cell. But once ammonia becomes ammonium ions, it is osmotically active, so it attracts water. So this causes swelling of all these cells, particularly neurons swell. And when the respiratory center neuron swells, that causes hyperventilation. So what is the respiratory, or what is the acid-base abnormality that you find in a patient of hyperammonemia? The most common acid-base abnormality that you'll find in a patient of hyperammonemia is respiratory alkalosis. So can you tell me, what is the reason for respiratory alkalosis? Because ammonium accumulates within neurons, it attracts water, neurons swell, respiratory center gets stimulated, the person hyperventilates, and that is why there is respiratory alkalosis. And not just that, whenever it attracts H plus ions, what happens to hydrogen ion availability within the cell? The free hydrogen ion availability within the cell decreases. And do you all remember that in electron transport chain, for electrons to be transported across this chain of complexes, there should be hydrogen ion which gets translocated. Do you all remember that? Inhibitory effect of GABA is withdrawn. I will tell you about that, Rahul. Can you answer this question? When ammonia gets converted to ammonium ions, I said hydrogen ions will not be available. When hydrogen ions are not available, can electron transport chain happen? Tell me yes or no. Electron transport chain will not be able to happen, because whenever electrons get transported across electron transport chain complexes, it's the hydrogen ions which get translocated. And when there is no hydrogen ion, electron transport chain terminates. So what will happen to ATP production? Without electron transport chain, ATP cannot be produced. And additionally, only because of all these mechanisms, because we know ammonia is toxic, whenever ammonia gets generated, we immediately allow ammonia to react with alpha ketoglutarate. I will keep asking you this every now and then. Whenever ammonia gets generated, we allow ammonia to react with alpha ketoglutarate and NADH to form glutamate. Yeah, we form glutamate, and this glutamate gets converted to glutamine. That way, what happens to alpha ketoglutarate, all of you? Because ammonia reacts with alpha ketoglutarate forming glutamate and glutamine. Tell me what happens to alpha ketoglutarate availability? That is low. When there is low alpha ketoglutarate, what will happen to citric acid cycle? One of the intermediates of citric acid cycle is alpha ketoglutarate. Without alpha ketoglutarate, citric acid cycle stops. And do you all know that citric acid cycle is like a final furnace wherein every fuel comes and gets oxidized? And you're switching off that final furnace. So again, what will happen? Low ATP production. Is that clear? So have you understood the mechanisms behind ammonia's toxicity? Yeah, everybody knows ammonia is toxic. Everybody knows ammonia crosses the blood-brain barrier. It causes encephalopathy, but that's not enough. You will have to know why ammonia is toxic. So why is ammonia toxic? The one statement that explains all mechanisms behind ammonia's toxicity is that it has got very high pKa. So what if it has got very high pKa? Ammonia becomes ammonium ions. Ammonium ions are osmotically active. They attract water. So neurons swell. So what is the acid-base abnormality that you find in a patient of hyperammonemia? Can you all answer that in the chat box? Any patient with hyperammonemia will present with respiratory alkalosis. And because ammonia reacts with hydrogen ions, what will happen to electron transport chain? Electron transport chain is terminated, and that is why there is low ATP production. And to avoid all these toxic effects of ammonia, what you do is you allow ammonia to react with alpha ketoglutarate, and that becomes glutamate and glutamine. So this causes low availability of alpha ketoglutarate. So citric acid cycle stops. When citric acid cycle stops, ATP cannot be produced. Why not metabolic alkalosis? This is not happening outside the cell. I can't, Vidyananda, this is not happening outside the cell. It is happening inside the cell. Do you see that? So within the cell, ammonia reacts with hydrogen ions to become ammonium. So it is not affecting the pH of the blood. It is affecting the intracellular pH. And that's why I didn't say metabolic alkalosis. I said respiratory alkalosis. Okay. So can you read all these statements and tell me whether these statements are true or false? Will there be oxidative decarboxylation of alpha ketoglutarate in advanced liver disease? In advanced liver disease, alpha ketoglutarate by itself is not available. In that case, will there be oxidative decarboxylation of alpha ketoglutarate? No, that does not happen. Citric acid cycle stops. Will there be hyperammonemia, all of you? Can you all answer this in the chat box? Will there be hyperammonemia? Yes. Will there be low ATP production? Yes. Will there be conversion of alpha ketoglutarate to glutamate and glutamine? Yes. So what is the final answer, all of you? The final answer is B, C, and D. There are three answers for this question. This is an INI-CET November 2021 question. Good. Yes, Rahul, you're right. So this is the next question. This is frequently asked. Can you answer this question? The most common non-toxic form of ammonia is, now that we know ammonia is toxic, yeah, you know, amino acid metabolism happens in virtually every tissue. So in every tissue, ammonia is getting generated, but finally urea cycle happens only in liver. So in one way or the other, you have to transport this ammonia in a non-toxic form from various tissues to reach the liver. So what is that non-toxic form in which you are transporting ammonia? You are transporting ammonia in the form of glutamate. What is answer? No, it is not alanine, it is glutamate. The most common non-toxic form of ammonia is glutamate. It is because what do we do in all the tissues? Wherever ammonia gets generated, the enzyme to act on ammonia is glutamate dehydrogenase. And this glutamate dehydrogenase allows ammonia to react with alpha ketoglutarate and NADH. It allows ammonia to react with alpha ketoglutarate and NADH to form glutamate and NAD. So can you see that here? Yeah, ammonia reacts with alpha ketoglutarate and NADH to form glutamate and NAD. And in the form of glutamate, ammonia is transported from all the peripheral tissues to reach the liver. So what is the most common non-toxic form of ammonia? All of you don't answer it as alanine. The most common non-toxic form of ammonia is glutamate. But there are two exceptions to this rule. One exception is neuron, the other exception is muscle. What is formed in neuron? Glutamine is formed in neurons, not glutamate in neurons, glutamine in neuron. In muscle, it is alanine. Okay. So why is glutamine formed in neurons? So I will tell you what happens in neurons. Even in neurons, as always, when ammonia gets generated, it reacts with alpha ketoglutarate and NADH to form glutamate. As always, even in neurons, what happens? Ammonia reacts with alpha ketoglutarate and NADH to form glutamate and NAD. When in all the other tissues, this glutamate immediately comes out of the cell, reaches the circulation. In neuron alone, this glutamate goes through another chemical reaction wherein glutamate reacts with one more molecule of ammonia and it forms glutamine. So what does glutamate do? It does not immediately reach the circulation. Glutamate reacts with one more molecule of ammonia to form glutamine, and the enzyme is glutamine synthetase. And this glutamine comes out of neurons, reaches the circulation. So can any one of you guess what is that we achieve by releasing glutamine in neurons? Instead of glutamate, by releasing glutamine in neurons, what is that we achieve? Don't you see that it's an optimal utilization of alpha ketoglutarate? I was telling you one of the mechanisms of ammonia toxicity is that ammonia causes low availability of alpha ketoglutarate. In that case, neuron, which is the principal cell of your body, won't you try to optimally utilize alpha ketoglutarate? You will do that. And that is why what do? You form glutamine. And by forming glutamine, you see that you are sequestrating two molecules of ammonia. Very good, Ponmalar. By doing this, you are sequestrating two molecules of ammonia, but you are using only one molecule of alpha ketoglutarate. Okay, so this is an optimal utilization of alpha ketoglutarate. That is why neurons form glutamine. And what is formed in muscle? I told you. In muscle, you form alanine. Why do you form alanine in muscle? Even in muscle, as always, glutamate dehydrogenase allows alpha ketoglutarate to react with ammonia and NADH. Neurotransmitter related, I don't see much of a difference because of neurotransmitter, because again here it forms glutamate, only then it becomes glutamine. Anyway, whenever there is hyperammonemia, there is glutamate formation in the central nervous system. And this glutamate, of course, causes neurotoxicity, and that's why hyperammonemia presents with seizures. That is why hyperammonemia presents with vomiting. Okay, so it's not related to neurotransmitter. The evolutionary explanation, Dr. Manoj Kumar, the evolutionary explanation for why glutamine is formed in neuron is it is optimal utilization of alpha ketoglutarate. Is that clear, Manoj? Yeah. So what happens in muscle? Even in muscle, as always, glutamate is formed, but this glutamate is not immediately released into the circulation. So in muscle, this glutamate undergoes a transamination reaction. It undergoes a transamination reaction with pyruvate. So what will glutamate get converted to? Do you all know that glutamate on transamination becomes a keto acid, which is alpha ketoglutarate? Yeah, glutamate, once it gives off its amino group, it becomes a keto acid, which is alpha ketoglutarate. And pyruvate on accepting the amino group will become alanine. So can you see that reaction here? So what happens in muscle? In muscle, the glutamate is not immediately released into circulation. This glutamate goes through another transamination reaction with pyruvate, forming alpha ketoglutarate and alanine. And that alanine will reach the circulation. So what do we achieve by releasing alanine from muscle? Do you see that this way you are regenerating alpha ketoglutarate, all of you? This way you are regenerating alpha ketoglutarate. Thereby in muscle you are allowing citric acid cycle to continue. Okay, so this is one advantage. Another advantage is by forming alanine, you are not only detoxifying ammonia, You're also detoxifying pyruvate. Do you all understand this? By forming alanine, you're not only detoxifying ammonia, you're also detoxifying pyruvate. Because if you allow pyruvate to accumulate in muscle, don't you all know that pyruvate will get converted to lactate? Don't you all know that pyruvate will get converted to lactate, and that lactate inhibits glycolysis in muscle? So by forming alanine, there are two advantages. One is you regenerate alpha ketoglutarate. The other one is you're detoxifying pyruvate also. So have you understood all the facts that I've told you so far? Which is the most common non-toxic form of ammonia? Can you all be active in the chat box? The most common non-toxic form of ammonia everywhere is glutamate. What are the two exceptions I told you? The two exceptions are neurons and muscle. What is that you form in neurons? In neurons, you form glutamine. In muscle, you form alanine. Okay. So what is the answer here, all of you? The most common non-toxic form of ammonia is glutamate. Good JG things. The non-toxic form of ammonia formed in neuron is, I will be happy if all of you answer this in the chat box. The non-toxic form of ammonia formed in neuron is, obviously it is glutamine. The non-toxic form of ammonia formed in muscle is, what is answer? Many of you answered it as the most common non-toxic form of ammonia is alanine. Do you understand the difference? The non-toxic form of ammonia formed in muscle is alanine. Okay, good. Now, this is an interesting question. It's a factual question. This keeps getting repeated in all entrance examinations. Yeah, so I will help you memorizing all these facts related to carbon skeleton catabolism. Listen to this carefully. Yeah, stay back for another 15 minutes. And by the end of 15 minutes, you'll be able to answer anything related to catabolism of carbon skeleton. Okay. So all of the following amino acids on catabolism give rise to pyruvate except. What is answer? Is it cysteine, glycine, alanine, methionine? What is answer? Vignesh says it is glycine. Glycine does give rise to pyruvate. Vignesh now says it's cysteine. Cysteine also gives rise to pyruvate. It is not cysteine or glycine. It is methionine. Yeah, what is answer? It is methionine. Have you all remember? Do you all remember the mnemonic VIM? Yeah, what does VIM stand for? VIM stands for valine isoleucine methionine. VIM is valine isoleucine methionine are the three amino acids which on catabolism give rise to succinyl CoA. Yeah, they give rise to succinyl CoA of citric acid cycle. So methionine comes under VIM amino acids. It does not give rise to pyruvate. It gives rise to succinyl CoA. Very good, Manoj. The answer is choice D. Okay. So now, how do we classify amino acids based on metabolic fate? Based on metabolic fate, you classify amino acids as purely glucogenic amino acids. The first type is purely glucogenic amino acids. Second one is purely ketogenic amino acids. And the third category will be those which are both glucogenic and ketogenic. Now, when will you call an amino acid as ketogenic, be it purely ketogenic or both ketogenic and glucogenic? Only when an amino acid on catabolism gives rise to acetyl CoA. Yeah, only when an amino acid on catabolism gives rise to acetyl CoA, you will call it as ketogenic. Now, what are the purely ketogenic amino acids? There are two purely ketogenic amino acids. One is leucine, the other one is lysine. So as and when I tell you something, please memorize it. What are the two purely ketogenic amino acids? One is leucine, the other one is lysine. And what are the amino acids which are both glucogenic and ketogenic? You can remember it as PIT. Yeah, you can remember it as PIT, or you can remember it as all three aromatic amino acids. Can you tell me what are the three aromatic amino acids? Phenylalanine, tyrosine, tryptophan. Yeah, phenylalanine, tyrosine, tryptophan. And along with this one branch chain amino acid which is isoleucine. Yeah, one branch chain amino acid which is isoleucine. So these four amino acids are both glucogenic and ketogenic. Have you memorized it so far? So what are the two amino acids which are purely ketogenic? Leucine and lysine. What are the amino acids which are both glucogenic and ketogenic? That will include 3 aromatic amino acids, phenylalanine, tyrosine, tryptophan, and 1 branch chain amino acid which is isoleucine. Now about glucogenic amino acids. When will you call an amino acid as glucogenic? For you to call an amino acid as glucogenic, it should either give rise to a glycolytic intermediate. Yeah, it should either give rise to succinyl-CoA can give rise to oxaloacetate, which in turn can give rise to pyruvate. No, Ponmala, that is not how we are going to memorize it. That way, if you look at, then everything will give rise to pyruvate. Do you understand this? And actually, pyruvate carboxylase is not a reversible step. From oxaloacetate, you don't get pyruvate. From pyruvate, you get oxaloacetate. Do you understand the difference? Yeah. So we are discussing about what are the immediate intermediates that they give rise to. So you cannot have such a long way, long route and say everything give rise to pyruvate. Do you get it? Yeah. Okay. So when will you call something as glucogenic? Only when an amino acid on catabolism gives rise to a glycolytic intermediate or a citric acid cycle intermediate other than acetyl-CoA. Yeah, only when an amino acid on catabolism gives rise to one of the glycolytic intermediates or one of the citric acid cycle intermediates other than acetyl-CoA, it can be considered as glucogenic. And all your amino acids on catabolism give rise to only one glycolytic intermediate, which is pyruvate. Yeah, what do? They give rise to only one glycolytic intermediate, which is pyruvate. And among citric acid cycle intermediates, your amino acids do not give rise to all citric acid cycle intermediates. They give rise to only 4 of them. And what are those 4 intermediates? The first one is alpha ketoglutarate, the one about which we discussed in the previous question. One is alpha ketoglutarate, second one is succinyl-CoA, the third one is fumarate, and the fourth one is oxaloacetate. And if you're asking, how do I remember this? How do I remember these random 4 names? You can have a statement which has no meaning. Yeah, just to remember, you can have a statement. What is the statement? Cats succeed funny oxes. Yeah, what's the statement? Cats succeed funny oxes. So for cats, what will you remember, all of you? For cats, you can remember alpha ketoglutarate. For succeed, you can remember succinyl-CoA. For funny, you can remember fumarate. For oxes, you can remember oxaloacetate. And you can have a visual memory from this image. Can you see a cat on an ox? Yeah, cat on an ox. So cat succeed funny oxes. So cat is alpha ketoglutarate, succeed is succinyl-CoA, funny is fumarate, oxes is oxaloacetate. Now, what are the 6 amino acids which give rise to pyruvate? Can you tell me at least one amino acid which gives rise to pyruvate? Do you all know that alanine on transamination forms pyruvate? All of you, alanine on transamination forms pyruvate. So one is alanine. The second one is the simplest amino acid. I don't believe in having mnemonics as far as amino acids are concerned, because there are so many amino acids which start with the same letter. Yeah, so don't go with just mnemonics as far as amino acids are concerned. You should somehow group them and remember. Yeah, so one is alanine, the second one is glycine, the simplest amino acid, glycine. And then 3 hydroxyl group containing amino acids. Can you all tell me what are the 3 hydroxyl group containing amino acids? Serine, threonine, and hydroxyproline. Okay, serine, threonine, hydroxyproline. And the last one is cysteine, one sulfur containing amino acid, which is cysteine. So all of you tell me what are the 6 amino acids which give rise to pyruvate. You start with alanine. Yeah, alanine, the simplest amino acid, glycine. And then I told you 3 hydroxyl group containing amino acids. What are the 3 hydroxyl group containing amino acids? Serine, threonine, tyrosine. Serine, threonine, hydroxyproline. And the last one is cysteine, which is a sulfur containing amino acid. So all these give rise to pyruvate. Okay. Now among citric acid cycle intermediates, the first one is alpha ketoglutarate. Can you tell me one amino acid which can give rise to alpha ketoglutarate based on the questions which we discussed before? Based on the questions which we discussed before, tell me one amino acid which can give rise to alpha ketoglutarate. Then I tell you glutamate on transamination gives rise to alpha ketoglutarate. So if glutamate can, glutamine can also give rise to same alpha ketoglutarate. So glutamate, very good Polmalar. Glutamate, glutamine, very good Jyoti Balan. So glutamate, glutamine, and then histidine. Yeah, histidine, proline, arginine. Yeah, histidine, proline, arginine. So what are the 5 amino acids which give rise to alpha ketoglutarate? It is glutamate, glutamine, histidine, proline, and arginine. Okay. Now, cats succeed. What is the next intermediate? The next intermediate is succinyl-CoA. I want you all to answer this. Succinyl-CoA is formed from what? Succinyl-CoA is formed from Vim amino acids. What does Vim stand for? Valine, isoleucine, and methionine. Okay, valine, isoleucine, and methionine give rise to succinyl-CoA. So cats succeed. Funny. Funny is fumarate. It's very easy to remember. Fumarate is formed from phenylalanine and tyrosine. Yeah, fumarate is formed from phenylalanine and tyrosine. And finally, it is oxaloacetate. It's very easy to remember. You form oxaloacetate from aspartate and asparagine. Oxaloacetate is formed from aspartate and asparagine. So can we quickly recall all that I've told you so far? So can you tell me what are the purely ketogenic amino acids? I want the chat box to be active, please. What are the purely ketogenic amino acids? That will include leucine and lysine. And what are the amino acids which are both glucogenic and ketogenic? That will include the 3 aromatic amino acids, phenylalanine, tyrosine, tryptophan, and 1 branch chain amino acid which is isoleucine. Okay. And then what are the glucogenic amino acids? All glucogenic amino acids give rise to either a glycolytic intermediate which is pyruvate, or they give rise to citric acid cycle intermediates. How do you remember those citric acid cycle intermediates? Cats, succeed, funny, oxus. So alpha ketoglutarate, succinyl-CoA, fumarate, and oxaloacetate. Okay, so only then you will call them as glucogenic amino acids. So can we try if we have memorized all the facts? Yeah, try answering this now. All of the following amino acids on catabolism give rise to pyruvate except. What will be your answer? Can give rise to pyruvate except it is methionine, because methionine gives rise to succinyl-CoA. All of the following give rise to acetyl-CoA except. Very good Jyoti Balan, very good Dawood, Akhil Methi, good. So what is answer? All of the following give rise to acetyl-CoA except. We know all 3 aromatic amino acids give rise to acetyl-CoA. Leucine is purely ketogenic. So what is answer? Very good Vignesh Vicky. The answer is again choice D, which is alanine. Because alanine gives rise to pyruvate. All of the following give rise to propionyl-CoA except. When I say propionyl-CoA, it means they're asking you what are the amino acids which give rise to succinyl-CoA. So can you tell me the answer? Succinyl-CoA, what is the mnemonic I gave you? The mnemonic is Vim. What does Vim stand for? Valine, isoleucine, and methionine. So what is answer? The answer is leucine, because leucine is a purely ketogenic amino acid which gives rise to acetyl-CoA. Yes, leucine gives rise to acetyl-CoA. All of the following give rise to alpha ketoglutarate except. Answer this. All of the following give rise to alpha ketoglutarate except. Good JG things. Answer the next question. Can anybody answer this? Alpha ketoglutarate, very good. Dawood, no. Vignesh, Vicky, very good. Yeah, so now do you understand why I asked you to not have mnemonics? Yeah, so what are the amino acids which give rise to alpha ketoglutarate? It is glutamate, glutamine. Yeah, glutamate, glutamine, histidine, proline, and arginine. Yeah, it is histidine, proline, and arginine, not asparagine. So what is the answer here? The answer here is choice D. All of the following are both glucogenic and ketogenic except. How did I ask you to remember this? Both glucogenic and ketogenic are aromatic amino acids, which are phenylalanine, tyrosine, and tryptophan. And then one branch chain amino acid, which is isoleucine. Excellent, Ponmalar. Yes, the answer is histidine. Very good, Jyoti Balan, Shobana, Akhil Methi, Shantanu. Very good. Dawood, Vignesh, Vicky. So now let's start discussing metabolism proper. Okay. So 6-year-old boy presents with periodic aggressive behavior. His urinary ALA is elevated. Where do you come across this intermediate ALA? ALA is a part of porphyria, right? Only in porphyria you will come across the term ALA. On examination, he is icteric. A mild hepatomegaly is observed. Blood examination revealed massive elevation of alpha fetoprotein. HPLC and tandem mass spectrometry examination revealed elevation of succinyl acetone. Very good, Ponmala. Elevation of succinyl acetone. The probable diagnosis is it type 2 tyrosinemia, or is it porphyria, or type 1 tyrosinemia, or type 3 tyrosinemia? Shobana says it is type 1 tyrosinemia. Do you all agree with her? Shobana says it's type 1 tyrosinemia. Do you agree with her? Jyoti Balan says it's choice B. Okay. So can we discuss this now? It is related to tyrosine metabolism. What makes me say it is related to tyrosine metabolism? This is a key word. Yeah, all of you memorize this. It's a take-home message for all of you. Whenever the question says succinyl acetone, it can be in any form. Yeah, if the question says succinyl acetone, close your eyes and mark it as type 1 tyrosinemia. Because succinyl acetone is a pathognomonic feature. Elevation of succinyl acetone is a pathognomonic feature of type 1 tyrosinemia. So can we discuss about tyrosine metabolism? Can you all help me discuss it? Yeah. So whenever I ask you which enzyme begins the metabolism of any amino acid, suppose I ask you which enzyme begins an amino acid metabolism, most of the times you will be right if you answer it as a transaminase. Most of the amino acids metabolism will be initiated by a transaminase. So tell me, what is the first enzyme of tyrosine metabolism? Even here it is tyrosine transaminase. And will you all agree with me if I call tyrosine as hydroxyphenylalanine? No, Shobana. We are not discussing about that. I will tell you about DOPA in a short while. For now, will you agree with me if I say tyrosine is hydroxyphenylalanine? Yeah. So this hydroxyphenylalanine undergoes transamination. We know alanine on transamination becomes pyruvate. So hydroxyphenylalanine on transamination will become hydroxyphenylpyruvate. So tell me, what is the product you get? The product that you get is para-hydroxyphenylpyruvate. The next enzyme is very good, Akhil Methi. So what logically should be the next enzyme? The next enzyme will be para-hydroxyphenylpyruvate dioxygenase. So this enzyme para-hydroxyphenylpyruvate dioxygenase converts para-hydroxyphenylpyruvate into a very famous intermediate, which is homogentisic acid. Yeah, what is that you get? You get homogentisic acid. So what logically should be the next enzyme? The well-known enzyme is homogentisate oxidase. So this homogentisate oxidase converts homogentisic acid. It converts homogentisic acid into homogentisic acid into mallyl acetoacetate. Now a cis-trans isomerase converts mallyl acetoacetate into fumaryl acetoacetate. Yeah, what you get is fumaryl acetoacetate. So all that you will have to do now is you have to cleave this. Only when you cleave this, you will get it as fumarate and acetoacetate. So which enzyme cleaves it? It is a hydrolase. So what is the last enzyme? The last enzyme is fumaryl acetoacetate hydrolase, which converts fumaryl acetoacetate into fumarate and acetoacetate. So do you all remember I told you that there are two amino acids which give rise to fumarate? All of you? Do you all remember I told you that there are two amino acids which give rise to fumarate? One is phenylalanine, the other one is tyrosine. Do you see that here? And did I tell you all aromatic amino acids are both glucogenic and ketogenic? Do you see that phenylalanine and tyrosine, they form both fumarate and acetoacetate. So they are both glucogenic and ketogenic. So this is about normal tyrosine metabolism. Now about disorders of tyrosine metabolism. First, let me tell you about type 1 tyrosinemia. Yeah, let me first tell you about type 1 tyrosinemia. Type 1 tyrosinemia is caused by a defect of, whenever I ask you type 1, all students say it is caused by the defect of the first enzyme. Answer is no. Type 1 tyrosinemia is caused by a defect of the last enzyme of tyrosine metabolism. So it is caused by a defect of which enzyme, all of you? It is caused by a defect of fumaryl acetoacetate hydrolase. Okay, and in this condition what accumulates? Fumaryl acetoacetate accumulates, and that gets converted to succinyl acetone. Fumaryl acetoacetate gets converted to succinyl acetone. That is why I told you, whenever you say or whenever you see that in the question they've given you succinyl acetone level is elevated, then what will be your diagnosis? Succinyl acetone elevation is pathognomonic of type 1 tyrosinemia. And this succinyl acetone is toxic to liver and renal parenchymal cells. Yeah, succinyl acetone is toxic to liver and renal parenchymal cells. So when liver cells get damaged, that causes jaundice. Yeah, that is why you call type 1 tyrosinemia otherwise as hepatorenal syndrome. Do you all understand this? That's why type 1 tyrosinemia is otherwise called as hepatorenal syndrome. So what did I tell you? The succinyl acetone that accumulates is toxic to liver and renal parenchymal cells. That is why it is called as hepatorenal syndrome. So what are the features? Whenever liver gets damaged, will it present with jaundice? Yes or no? Will it present with jaundice? Yes. Will it present with hepatomegaly? Yes. Will it present with liver cirrhosis? Yes. Hepatocellular carcinoma. So whenever you see that a young child, yeah, a young child is presenting with hepatocellular carcinoma with a massive elevation of alpha fetoprotein, what you can suspect is type 1 tyrosinemia. Reason is succinyl acetone is toxic to liver parenchymal cells. And when kidneys get affected, because it's hepatorenal syndrome, and kidneys get affected, that will present as Fanconi syndrome and as renal failure. Yeah, it presents as Fanconi syndrome and as renal failure. And because the succinyl acetone inhibits delta ALA dehydratase, because the succinyl acetone inhibits delta ALA dehydratase, delta ALA level is elevated. And ALA is toxic to neurons. Yeah, ALA is toxic to neurons, and that is why they present with neuropsychiatric manifestations. So whenever you see a child with neuropsychiatric manifestations, for example, the child is complaining of aberrant pain in the abdomen, you're doing all investigations. Every investigation turns out to be normal. And the child also has got bizarre behavior. Then you will suspect porphyria. And whenever you suspect porphyria, you will ask the laboratory to estimate ALA and PBG. And in this case, ALA level is also elevated. So many a times type 1 tyrosinemia will be misdiagnosed as porphyria. Do you all understand this? Many a times type 1 tyrosinemia will be misdiagnosed as porphyria. To be very specific, it mimics ALA dehydratase deficient porphyria. So what is the carry home message here? There are few key points that I want you all to remember. Succinyl acetone, immediately think of type 1 tyrosinemia. A young child presenting with an elevation, massive elevation of AFP with hepatocellular carcinoma, think of type 1 tyrosinemia. A young child presenting with porphyria-like manifestations with ALA elevation and succinyl acetone also to be elevated, think of type 1 tyrosinemia. Are you clear about all these? Yeah. So that's all about type 1 tyrosinemia. Now about type 2 tyrosinemia. Type 2 tyrosinemia is caused by a defect of tyrosine transaminase. How do we remember it? Do you see that in the name of the enzyme there are two T's? All of you? Do you see that the name of the enzyme has got two T's? So type 2 tyrosinemia is caused by a defect of tyrosine transaminase. And how many eyes do we have? We have two eyes, right? So type 2 tyrosinemia is called as oculocutaneous syndrome. Yeah, type 2 tyrosinemia is otherwise called as oculocutaneous syndrome because it presents with painful corneal erosions. Because it presents with painful corneal erosions and with palmar hyperkeratosis, very rough skin in the palm. Sudden erosion, sudden corneal erosion, spontaneous corneal erosions and very thick palm, then you can suspect type 2 tyrosinemia. And type 2 tyrosinemia is otherwise called as Richner-Hanhart syndrome. Okay, type 2 tyrosinemia is otherwise called as Richner-Hanhart syndrome. So what are the facts that you have learnt about type 2 tyrosinemia? How will you remember about type 2 tyrosinemia? 2 will have two T's. What are the two T's? Tyrosine transaminase defect. It is caused by tyrosine transaminase defect. Two I's. So it presents as oculocutaneous syndrome. It presents with painful corneal erosions and palmar hyperkeratosis. It is also called as Richner-Hanhart syndrome. Okay. Now the next disorder is para-hydroxyphenylpyruvate dioxygenase. Whenever there is a defect of para-hydroxyphenylpyruvate dioxygenase, we call it as type 3 tyrosinemia. And this type 3 tyrosinemia presents with recurrent seizures. Type 3 will present with recurrent seizures and with intermittent ataxia. Yeah, presents with intermittent ataxia. So I want you all to know well about para-hydroxyphenylpyruvate dioxygenase because there are so many clinical features or clinical correlations related to para-hydroxyphenylpyruvate dioxygenase. One is just now I told you defect of this enzyme causes type 3 tyrosinemia. There is gain of function mutation. Yes, there is a gain of function mutation of para-hydroxyphenylpyruvate dioxygenase that is called as Hawkinsinuria. So all of you tell me what is the cause of Hawkinsinuria. Remember, Hawkinsinuria is a gain of function mutation. Gain of function mutation of which enzyme? Para-hydroxyphenylpyruvate dioxygenase. And the third fact that you have to remember about para-hydroxyphenylpyruvate dioxygenase is there is a drug which acts by inhibiting this enzyme. Which drug is it? Yeah, the drug which acts by inhibiting para-hydroxyphenylpyruvate dioxygenase is nitisinone. So can you tell me when will you prescribe nitisinone? Based on this flow chart, can you tell me when will you prescribe nitisinone? Yeah, whenever the block is, whenever there is an enzyme defect after this. Yeah, whenever there is an enzyme defect after this. For example, can you prescribe nitisinone for type 1 tyrosinemia? Can I see answers here? Will you prescribe nitisinone for type 1 tyrosinemia? Yes, because if you block here, there is no succinyl acetone that is getting formed. So nitisinone can be prescribed for type 1 tyrosinemia. Okay, can you prescribe nitisinone for alkaptonuria, all of you? What is alkaptonuria due to? Alkaptonuria is because of a defect of homogentisate oxidase. So when homogentisate oxidase is defective, homogentisic acid accumulates. And this homogentisic acid will get converted to melanin-like fibrils and that causes eucranosis. So if you see a patient suffering from alkaptonuria with multiple intervertebral disc bulges and disc prolapses, this patient is suffering from eucranosis and that eucranosis because of accumulation of homogentisic acid. Then what will you try to block? You will try to block para-hydroxyphenylpyruvate dioxygenase and you can give nitisinone. Okay. Can you give nitisinone for Hawkinsinuria? All of you answer this. Can you prescribe nitisinone for Hawkinsinuria? Yes, because Hawkinsinuria is a gain of function mutation of para-hydroxyphenylpyruvate dioxygenase. So logically, the treatment would be to inhibit it. So what are the facts I've told you so far? I've told you that nitisinone, all of you please listen to this. Nitisinone acts by inhibiting which enzyme? It acts by inhibiting para-hydroxyphenylpyruvate dioxygenase enzyme. And this nitisinone is used as a treatment for type 1 tyrosinemia. It can be used even to treat alkaptonuria or to treat Hawkinsinuria. Okay, nitisinone can be used to treat type 1 tyrosinemia, alkaptonuria and Hawkinsinuria. Will you prescribe nitisinone for type 2 tyrosinemia, all of you? Will you ever prescribe nitisinone for type 2 tyrosinemia? No, because the block is here. If the block is here, if you again block it downstream, it is going to cause only detrimental effects. Is that clear? So nitisinone is contraindicated. I have given everything in the PDF. I will be sharing the PDF later. Yes, it is contraindicated. Nitisinone is contraindicated in type 2 tyrosinemia. So can you all answer this question now? What are the keywords that you find here? Yeah, all keywords are present. Succinyl acetone. What will be a suspicion? Immediately go for type 1 tyrosinemia. Young child presenting with a massive elevation of AFP. Again, it is type 1 tyrosinemia. Okay. And porphyria. ALA elevation porphyria. Again, it is type 1 tyrosinemia. Another question, a 11-year-old boy presented with a massive elevation of alpha-fetoprotein. He has had recurrent episodes of jaundice since birth. At the age of 9, he was diagnosed with porphyria. His urine shows succinyl acetone. What is your answer? Very good, Paul Praveen Kumar. Jyoti Balan. What is answer now? Again succinyl acetone, again porphyria, again jaundice, massive elevation of alpha-fetoprotein. So all these are hepatorenal syndromes feature. Very good, Shobana. Answer is very good, Akhil. Good, Jyoti Balan. So answer is type 1 tyrosinemia. Now tell me the answer. Nitisinone is used in the treatment of all except. I've already explained you this. Nitisinone can be used in the treatment of all except. I said it is definitely used for type 1 tyrosinemia, alkaptonuria and Hawkinsinuria. So it is contraindicated in which condition? Good, Jyoti Balan. Excellent. Good, Akhil. Shobana. Very good. So it's contraindicated in type 2 tyrosinemia. Teresa Maya Mambu. I told you nitisinone can be used for alkaptonuria. It should not be given for type 2 tyrosinemia. So answer this. Again, a known question, known fact. Please answer this. Type 2 tyrosinemia is characterized by all except Palmar hyperkeratosis, corneal ulcer, porphyria, oculocutaneous syndrome. So what are the facts I asked you to remember about type 2 tyrosinemia? It is caused by a defect of tyrosine transaminase. Very good. Good, Akhil. Shobana, Vignesh, Paul, Praveen Kumar, Manoj, I'm very happy. Shantanu, excellent. So what is it? Oculocutaneous syndrome. So it presents with painful corneal erosions, Palmar hyperkeratosis. That is why it's called as oculocutaneous syndrome. It does not present as porphyria because porphyria is a feature of type 1 tyrosinemia. Okay. All of the following are specialized products that are obtained from tyrosine except. Answer this. Do you get dopamine from tyrosine? Do you get melanin from tyrosine? Epinephrine, serotonin. What is answer? Tyrosine can give rise to neurotransmitters. What are the neurotransmitters? Dopamine, norepinephrine. Very good, Akhil. It gives rise to dopamine, norepinephrine and epinephrine. It gives rise to melanin. It gives rise to epinephrine. Whereas serotonin, what is serotonin, all of you? Serotonin is 5-hydroxytryptamine. Yeah, what is serotonin? 5-hydroxytryptamine. Tryptamine will be synthesized from tryptophan. So tyrosine does not give rise to serotonin. Is that clear? Yeah. So can we discuss how do we convert tyrosine into neurotransmitters? You have tyrosine. The first enzyme that converts tyrosine into neurotransmitters will be tyrosine hydroxylase. Good, Vignesh. The first enzyme is tyrosine hydroxylase. Don't we all know that tyrosine is hydroxyphenylalanine? So hydroxyphenylalanine is undergoing one more hydroxylation. So don't you think the product will be dihydroxyphenylalanine? Yeah, the product will be dihydroxyphenylalanine, which is nothing but DOPA. And this DOPA, in the presence of DOPA decarboxylase, gets converted to dopamine. Yeah, DOPA in the presence of DOPA decarboxylase gets converted to dopamine. Dopamine in the presence of dopamine beta hydroxylase gets converted to norepinephrine. Norepinephrine undergoes methylation to form epinephrine. Yeah, all of you. I want you all to develop patience in understanding concepts and in memorizing facts. Okay. So if you're very quick, if you want to quickly learn everything, then the retention will also be very less. So try to understand a pathway. If you understand this pathway, never will you forget that tyrosine will give rise to dopamine, norepinephrine, and epinephrine. So do not fall for shortcuts. Yeah, always spend some time in learning. In that case, retention will also be better. Okay. So how do you convert tyrosine into neurotransmitters? The first enzyme is tyrosine hydroxylase, which converts tyrosine to DOPA. DOPA decarboxylase. This is a neat question. Which is the coenzyme for DOPA decarboxylase? DOPA decarboxylase requires which vitamin? It needs pyridoxal phosphate. Yeah, this is a neat question. So all of you remember pyridoxal phosphate is necessary for transamination reactions and for decarboxylation reactions. They are necessary for transaminases and decarboxylases. So DOPA decarboxylase requires pyridoxal phosphate. And then dopamine beta hydroxylase requires vitamin C. This was also asked in NEET. Yeah, dopamine beta hydroxylase requires vitamin C. How do we remember it? Don't you all know that vitamin C is necessary for prolyl hydroxylase and lysyl hydroxylase? Yeah, vitamin C is necessary as a coenzyme for prolyl hydroxylase and lysyl hydroxylase. So remember all these hydroxylases together. So vitamin C is necessary for prolyl hydroxylase, lysyl hydroxylase, and dopamine beta hydroxylase. And this is how tyrosine gets converted to neurotransmitters, namely dopamine, norepinephrine, and epinephrine. The second use of tyrosine is that it gets converted to melanin. Yeah, it gets converted to melanin by the action of tyrosinase. Third use is tyrosine will give rise to thyroid hormones. Don't we know that? Yeah, thyroglobulin, tyrosine undergoes iodination to form monoiodotyrosine and diiodotyrosine. And these monoiodotyrosine and diiodotyrosine will undergo coupling to give rise to thyroid hormones. So these are the specialized products that you get from tyrosine. So what is not obtained from tyrosine is serotonin, because as you all answered, serotonin is obtained from tryptophan. A 20-year-old boy with severe mental retardation, mousy odor in body fluids, hypopigmentation. Patient has frequent episodes of seizures and aggressive behavior. What is your diagnosis? So what is the key word here? Of course, there are multiple features provided here like mental retardation, hypopigmentation, seizures, aggressive behavior. But do you see a clue that is provided to you here? The clue, the simple clue that is provided to you here is mousy odor. Yes, very good Shobana, very good Shantanu, good Paul. So mousy odor is a feature of untreated phenylketonuria. Okay, so can we learn about urine odors and disorders? Yeah, can we learn about urine odors and disorders? The first urine odor that I want you to remember about is mousy odor, which is a feature of phenylketonuria. And how will you remember it? Don't you know that mouse and keyboard go hand in hand? Yeah, mouse and keyboard. Yeah, mouse and keyboard go hand in hand. So mousy odor, key is phenylketonuria. Mousy odor is a feature of phenylketonuria. Okay. And the next one is fruity odor. What is the next one? The next one is fruity odor, which is a feature of diabetic ketoacidosis. And the third one is already some of you had mentioned it, cabbage odor. Yeah, the third one is cabbage odor, which is a feature of type 1 tyrosinemia. Cabbage odor is a feature of type 1 tyrosinemia. How do we memorize it? Have a look at this image. Mostly visual memory will help you. So do you see that in this image, they have repurposed tire. Yeah, they've repurposed tire to grow cabbage. So what will you use this to remember? Cabbage odor is a feature of tire, which is tyrosinemia. Okay, so that's a feature of type 1 tyrosinemia. And the next one is on top of cabbage, it is boiled cabbage odor. Yeah, the next one is boiled cabbage odor, and that is a feature of hypermethionemia. Okay, boiled cabbage odor is a feature of hypermethionemia. How I remember it is cabbage by itself is, I don't like cabbage odor, and boiled cabbage odor is too much to handle, right? Yeah, boiled cabbage odor is too much to handle, too much hyper. Yeah, too much hyper. So boiled cabbage odor is a feature of hypermethionemia. The next one is something to do with methionine again. It is methionine malabsorption syndrome. The next one is methionine malabsorption syndrome. And this is characterized by Oast house odor. Yeah, what is it? It is Oast house odor. So if you're asking me what is an Oast house, this is an Oast house. Okay, so what is this Oast house used for? It is used for drying hops flour. Yeah, it is used for drying hops flour, and then they use this dried hops flour to add flavor. They use this dried hops flour to add flavor to beer. And that is why this disorder is also called as beer baby syndrome. Okay. And you can use this image to remember. Do you see blue sky and white clouds? Yeah, do you see blue sky and white clouds? So you can use this image to remember that Oast house syndrome is characterized by blue eyes and white hair. Yeah, it is characterized by blue eyes and white hair. So have you understood all these facts? Have you memorized all these facts? Yeah, so what did I tell you? Oast house odor. Yeah, Oast house odor or beer baby odor is a feature of methionine malabsorption. Okay. And then the next one is, have you heard of Hawkinsonuria? Swimming pool odor. Yeah, swimming pool odor is a feature of Hawkinsonuria. Swimming pool odor is a feature of Hawkinsonuria. I already told you about Hawkinsonuria, right? What did I tell you about Hawkinsonuria? I said gain of function mutation of para-hydroxyphenylpyruvate dioxygenase causes Hawkinsonuria, and that is characterized by swimming pool, for which you can have this image in mind. Do you see a hawk flying above the pool? Yeah, a hawk flying above the pool. So Hawkinsonuria is characterized by swimming pool odor. Okay. And the next one is sweaty feet odor. The next one is sweaty feet odor is a feature of isovaleric acidemia. It's a feature of isovaleric acidemia. So how do we remember it? You can remember it using this image. Yeah, do you see a feet kept on the ice? Yeah, feet kept on the ice. So sweaty feet odor is a feature of isovaleric acidemia. And then have you heard of maple syrup odor? Maple syrup odor or burnt sugar odor. So burnt sugar odor is a feature of maple syrup urine disease. Okay. And then tomcat urine disease. Tomcat urine disease is caused by, it's a feature of multiple carboxylase deficiency. It's a feature of multiple carboxylase deficiency. How do we remember it? Cat has got Ca. Carboxylase also has got Ca. So tomcat urine odor is a feature of multiple carboxylase deficiency. Okay. So have you memorized all these urine disorder, urine odor and disorders? Yeah. So can you tell me all these odors? So start with mousy odor. So mousy odor is a feature of what? Phenylketonuria. Fruity odor is a feature of diabetic ketoacidosis. Yeah, fruity odor is a feature of diabetic ketoacidosis. And then from fruit, it is vegetable. Cabbage odor is a feature of type 1 tyrosinemia. From cabbage odor, it is boiled cabbage odor. So what did I tell you about boiled cabbage? It is too much to handle. It is hypermethionemia. Hypermethionemia. After hypermethionemia, something to do with methionine is methionine malabsorption syndrome. So methionine malabsorption syndrome is characterized by Oast house odor or beer baby odor. Very good, Paul. Beer baby odor. Okay. And then we have swimming pool odor, which is a feature of Hawkinsonuria. Sweaty feet odor. What is sweaty feet odor due to? It is because of isovaleric acidemia. I asked you to remember feet that is placed on an ice, right? So sweaty feet odor is a feature of isovaleric acidemia. And then burnt sugar odor. Burnt sugar odor is a feature of maple syrup urine disease. And finally, tomcat urine odor. Tomcat urine odor, cat CA. It is caused by multiple CA carboxylase deficiency. Okay, so that's all about urine odor and diagnosis. I hope it's clear to all of you. So this is the next question. A 9-year-old child presents with short stature, polyuria, polydipsia, and photophobia. On slit lamp examination, cornea shows characteristic crystals in the eye. The probable diagnosis is, what do you think is the right answer? There are few features: short stature, polyuria, polydipsia, and photophobia. On slit lamp examination, the cornea shows characteristic crystals in the eye. Very good. Paul Praveen Kumar, very good. He says cystinosis. Shobana says homocystinuria. Jyoti Palan says it's homocystinuria. So can we exclude choices? It's not homocystinuria. Why is it not homocystinuria? Because homocystinuria will present as what? It will present as accelerated atherosclerosis. It will present as accelerated thrombosis, young MI, young stroke. Suppose a 30-year-old patient is coming to you with a stroke, a 35-year-old patient coming with MI. In that case, you can suspect homocystinuria. An eye manifestation of homocystinuria will be spontaneous dislocation of the lens. Yeah, infronasal spontaneous dislocation of the lens will be a feature of homocystinuria. It is not going to present with characteristic crystals in the cornea. Do you all understand this? So this is not homocystinuria. Can it be cystinuria? It is not cystinuria, because cystinuria, what is cystinuria due to? It is because of a defect of a neutral amino acid transporter. So along your proximal convoluted tubule, there is one neutral amino acid transporter which reabsorbs 4 amino acids. And those 4 amino acids can be remembered using a mnemonic COLA. What does COLA stand for? Cysteine, ornithine, lysine, and arginine. So cysteine, ornithine, lysine, and arginine are the 4 amino acids which get reabsorbed along the renal tubules through one common transporter. And if that common transporter is defective, all these amino acids will be found in urine. So it will present as aminoaciduria. And when there is supersaturation of cysteine, cysteine will form cystine stones. Yeah, cysteine will form disulfide bridges to form cysteine, and that cysteine is insoluble in urine, so it gets precipitated forming stone. So what does cystinuria present as? Cystinuria presents as recurrent renal stones or recurrent obstructive uropathy. It is not going to present as polyuria, polydipsia, photophobia, and short stature. It will present only as recurrent renal stones. And how do you specify about those stones? How do you characterize those stones in cystinuria? Those are hexagonal crystals. So can you describe this image, all of you? How will you describe this image, the crystal that is shown here? It has got 6 sides. It's a hexagonal crystal, and that's a feature of cystinuria. How do we remember it? Do you see that it sounds like 6? Cis sounds like 6, right? So cystinuria, it is characterized by hexagonal crystals. Okay. And about other renal stone crystals, can you give a name to this? Just describe these crystals which I've shown you in the image. Does it look like an envelope? Yeah, it looks like an envelope. So envelope shaped crystals. And do you see an X in the center? Yeah, you see an X in the center. X stands for oxalate. So envelope shaped crystals are nothing but calcium oxalate crystals. And how do we remember it? Oxalate has got an X. Okay, so it is envelope. And then describe this. Does it look like a rectangle, all of you? Yeah, rectangle or rhomboid. If it's like this, it's rectangle. This is rhomboid. So rectangle or rhomboid shaped crystals are features of urate crystals. Yeah, how do we remember it? U, this is how you write U, right? So if you close this, that is rectangle. If you close this, that's rhomboid. So urate crystals are rectangular crystals or rhomboid shaped crystals. Okay. And the last one is, how do you describe this? How will you describe this? Don't you think it looks like a coffin lid? Yeah, don't you think it looks like coffin lid? So this is coffin lid appearance. And coffin lid appearance is a feature of struvite crystals, struvite stones. And what is that you know about struvite stones? Do you know struvite stones result in staghorn calculus? Mostly struvite stones result in staghorn calculus. Do you think staghorn calculus is a milder condition or a severe condition? When the entire pelvic calyceal system is occupied by a renal stone, that is called a staghorn calculus. It's a severe condition. So severe condition is like the death of the patient. Death is coffin. Yeah, that is how I remember it. So coffin lid appearance is a feature of struvite stone. And how do we remember it? Struvite stone most commonly will present a staghorn calculus. And it is most commonly found. Struvite crystals are most commonly formed whenever there is an alkaline pH, as which happens in upper urinary tract infection. Yeah, as which happens in upper urinary tract infection. For example, any urease producing microorganism, will convert the urea of urine to form ammonia. And whenever ammonia is formed, it causes the pH of the urine to be alkaline. And this alkaline pH favors struvite stone formation. And the chemical composition of struvite stone is MAP. What is MAP? Magnesium ammonium phosphate. Yeah, what is the chemical nature of struvite stone? It is magnesium ammonium phosphate. So can we fill up this tabular column? Can you help me fill up this tabular column? The first shape that you will have to know about is coffin lid. So tell me about coffin lid shaped crystal. What is the chemical composition? I said it is MAP, magnesium ammonium phosphate. In which condition do you find magnesium ammonium phosphate stones? It is found whenever there is an alkaline pH, as which happens following upper urinary tract infection. Okay. And the second one is envelope shaped crystals. So envelope shaped, in the center you have X. So the chemical composition is calcium oxalate. Yeah, condition is whenever there is low citrate, that is available in the tubular fluid, then calcium oxalate crystals will be formed. And then hexagonal crystals. Hex 6, right? 6 is cis. So it is cystine. And which condition do you find cystine stones? It is cystine urea. Okay, it is cystine urea. And then the last one, what is the last one I told you about? Rectangular or rhomboid shaped. Rectangular or rhomboid shape will be uric acid crystals. Okay, that's about renal stones. So that's about cystine urea. So cystine urea presents only as recurrent renal stones. Now about cystinosis. Cystinosis is a totally different disorder. And cystinosis is actually a lysosomal storage disorder. Yeah, wherein there is defective efflux of cysteine from lysosomes. Cysteine is not able to come out of lysosomes. Do you know that usually proteins undergo catabolism in lysosomes? Whenever a protein's lifespan gets over, it gets broken down in lysosomes to give rise to individual amino acids. After which these individual amino acids are supposed to come out of lysosome and they are supposed to get into mitochondria. Why should they get into mitochondria? Because only in mitochondria they can get oxidized. So what will happen when there is defective efflux of cysteine from lysosome? Cysteine will accumulate within lysosomes, and chronic accumulation of cysteine within lysosomes will cause lysosomal degranulation. Yeah, that will cause lysosomal degranulation, and that causes local tissue damage. And whenever local tissue damage happens in proximal convoluted tubule, yeah, whenever local tissue damage happens in proximal convoluted tubule, it causes Fanconi syndrome. What will be the feature of Fanconi syndrome, all of you? It will present with polyuria, polydipsia, short stature. And whenever there is local tissue damage that happens in iris will undergo depigmentation. So all light will start getting into the eye. So the child will complain of photophobia. So if you see a child, all of you listen to this, if you see a child presenting with polyuria, polydipsia, short stature, and if the child also complains of photophobia, do a slit lamp examination. And slit lamp examination will show characteristic cystine crystals in the cornea. And these cystine crystals are sequin-like. Have you seen sequins? Yeah, or glitters, yeah, shimmery, yeah, sequins or glittery or shimmery crystals. If you see them on the cornea, then that is cystinosis. Do you all understand this? That is cystinosis. So tell me, what is the diagnosis here? Short stature, polyuria, polydipsia, photophobia, slit lamp examination shows characteristic crystals in the eye. So the answer would be what? The answer will be cystinosis. Okay. So these are the essential facts that you need to know as far as amino acid metabolism is concerned. Okay, so try to read amino acid metabolism and try to revise try to work out as many MCQs as possible. If you have any doubts, you can ask me. Okay, so thank you all. Good night.